Hi, my name is Byung-Joon Kim, a professor in the Department of Public Administration at Kookmin University, Seoul, Korea. And I would like to welcome you to Digital Government Policy and Best Practice in E-Government of Korea, as well as give you an overview of what you can expect from this chapter. K responses for COVID-19, releasing and utilization of open data and ICT. This chapter helps public managers understand that Korea has been effectively responding the pandemic due to mass spreading of the COVID-19 virus. One of the key success factors is the releasing and utilizing public data and advanced ICTs with timely manners. The Korean responses, we call it K response, could be the case for every nation to struggle with the largest scale of the contagious disease. Korean lessons are shared and developed together with all neighboring countries. From the beginning of the COVID-19 outbreak, Korean responses have mentioned as a successful case for many other countries. In this chapter, you will learn how Korean government manages these pandemics with advanced ITCs and open data approaches. Especially the Minister of the Interior and Safety and Korean Center for Disease Control works as important roles for dealing with these efforts with citizens. The key successful factors such as expansion of citizen participation, including apps developers, the importance of the securing and preparing the stable ICT infrastructures, and the needs of the digital collaboration platform as well. These are discussed in this course. We will utilize the online learning due to COVID-19 and using online platform to help you learn. I look forward to working with you this chapter.
As you can see, the Korea faced the rapid increase of COVID-19 cases when came into Korea and affected widely. However, 3T, testing, tracing, and treatment, with well-established ICT system, COVID-19 could be under controlled in Korea. The COVID-19 response system is a part of the disaster management system in Korea, with the Framework Act on the Management of Disasters and Safety. Two ministries, MOIS and MOHW, collaborate effectively, and local agencies under the leadership of Prime Minister. MOIS equals the Ministry of Interior and Safety, MOHW equals the Ministry of Health and Welfare. Before we learn about the details on the K response system, I would like to emphasize the important role of MOIS. MOIS has been working on facilitating, coordinating, and cooperating among the central agencies that fight against the virus. The notion of governance facilitator is critical for the success. MOIS is working on operating a government-wide unit for COVID-19 and managing 16 treatment centers as well as 26 shelters for the infected patients. Also, MOIS is overseeing the management of self-quarantine with the tracing systems. In addition, MOIS checks the status and monitoring of disease prevention control state at sites including joint investigation on high-risk facilities, planned examination on blind spots, and safety monitoring, as well as prepares and sends disaster alert text message and TV captions on daily topics which are related to COVID-19. To prevent this type of contagious disease, 3 important domains are important, and those domains are managed by NIA very well. First, government should have collaborating process within government. Second, the basis of IT infrastructure that is used for releasing and sharing the data and information. Third, the cooperation with citizens and businesses are important. Thus, the well-established system and partnership is important for developing the K response system for COVID-19. There was the one best example to show the importance of public-private partnership, which is utilizing mask data apps. Citizens could find the right drugstore to buy the masks without any unnecessary visits. Based on public big data, a private apps developer could make this apps. The level of public complaints was decreased. Also, self-diagnosis app and finding nearby screening center online map. Commercial portal Naver developed a map for that purpose. Thus, with the developed IT and open data system, ICT service for preventing COVID-19 was very well developed, and it has PPP basis. As you see the structure map, the steps of all preventing COVID-19, ICT works critical roles. KCDC, Korea Center for Disease Control, has information sharing systems with public health centers and medical institutions on all related data and information so that we could see the highly intelligent ITS in Korea. This is a good example of PPP and using ICT for preventing COVID-19. Secondly, the higher level of citizenship was very critical to deal with COVID-19. Many global press reported the drive-through screening system in Korea aggressively. Press wanted to say the nobility of system itself. However, we think that without active citizen participation, this noble system didn't work perfectly. In addition, citizen reports worked as a bridging role for connecting public and private sectors about COVID-19 information and data. Thus, the expansion of citizen participation is important for the success of K-response. Third, to solve social problems arising from the purchase of masks in Korea, Government of Korea has released the mask data, code of sellers, time and quantity of warehousing, number of mask sales. As you can see, the concept diagram, all parties related to distrusting facial masks heavily rely on the use of ICT infrastructures. The stable ICT infra of Korea works a critical factor for the success of K-response. Even though currently all over the world are facing the second wave of pandemic, we could cope with the virus well with a stable ICT infrastructure. Let's look at the details. First, Health Insurance Review and Assessment Service, HIRA, public agency, relays mask sales data. NIA repacked data with adding inventory segmentation and address-based latitude and longitude coordination conversion. And private could business provided data API server and developed environment for programming. Finally, civic hackers or developers developed web/app service quickly. As you can see this figure, stable ICT infrastructures are important for developing this integrated information support system for infectious disease management. Also, the ICT framework of the smart quarantine system was working well, and currently we can make a model for how all shareholders collaborated all together by using stable ICT infrastructures. For example, the International Roaming Information Sharing System and process was showing the importance of stable ICT infrastructures as well as PPP and citizen partnership. This map also shows what we discussed before. In the core of network, there is app, ICT. We live in a different world comparing 1 or 2 decades ago. Even though technologies are changed so fast, hopefully basic ideas and frameworks should be utilized for preventing infectious disease. Here is another example, Self-Health Check App Service. As you see the flowchart, with the power of ICT infrastructures, so far we could manage well COVID-19. Finally, the development of digital collaboration platform is very important. Central Disaster Management Headquarters and Central Disease Control Headquarters have established official web page for COVID-19, providing daily cases and briefing of the Korean government. There are 4 main functions: data visualization, trends, news and issues, and policy of damage support. Government of Korea has released key datasets as issue data through National Data Portal for its reuse and analysis by private sector. Also, DUR can be the example of digital collaboration platform. DUR, HW, and SW structure are like this. ITS and DUR is connected so that we can see the synergy effects of connecting services. Lastly, digital collaboration platform could be more important than before. The second wave of pandemic comes, the role of digital devices is not the option, but it is must-have one for preventing COVID-19. We hope we can learn about Korean experiences to deal with COVID-19 with ICT.